by identifying the pieces and parts. So I had emphasized to you last time the importance of the articulation of the dens of the axis in the fovea dentis of the atlas. And we talked about the structure here of the superior articulating facet. This is a really important spot, and I always blather on at this point in the lecture time about the important ligaments, the cruciate and transverse ligaments, and anterior and posterior longitudinals and all this kind of stuff, and students never see the pictures. And so I thought, well, I'm going to change that this year. So I put these in here today because you heard me speaking of them. There's a lot of information on the next couple of pictures you don't have to know from me. But I want to show you some of the major ligaments surrounding these bones, holding these things in place, and give you better context than just speaking it. So this is a picture of this area right here. This is, as you can see, a posterior view, and there's a bunch of words on here that's for something else. You don't have to know all that. But I want to show you the articulation here and how, because you get the impression when you hear me first say this, oh, this is so dangerous. And you're right, it is. But it's also a pretty secure location. So I want you to look here and see, I've got them labeled here so that I can, numbered so I can not get myself distracted. So first of all is labeled what's called the posterior longitudinal ligament. So there's the dens right there. Here's the occipital bone right here. So you can see, so here's the articulation between the atlas and the occipital bone. So that's that facet, this facet right here. So that facet right there is articulating with the occipital. There's the dens. So this is a posterior view. So what's happened here in this picture, you're looking at this picture right here, you're actually looking at it from the back. So this is a posterior view. So what has been removed? What part of the bone is not there in this view? So we're looking at this view right here, but can you see that all of these pieces and parts, the posterior arch of the atlas, the spinous process, the lamina, the pedicles have been cut, and so all of that back part has been taken off now. And what else is gone? What's inside this vertebral foramen? Spinal cord is in there, right? So the spinal cord is in this hole right here, passing down through the vertebral column. There's the arch of the atlas and the arch of the axis right there. Those have been taken off. And I go down in there deep now. The spinal cord has been removed. So here's where you can see here where the pedicles have been cut. And so the spinous processes and the lamina are off. The spinal cord has been taken out. And I am looking from the back all the way in at the articulation between the dens and the fovea dentis. Now, what I want you to see here is a couple things. One, there's a posterior longitudinal ligament here that extends the length of the vertebral column. Let me show you where it is. So look on this picture right here. Here's another shot here. So here's the posterior side where the spinous processes, and here's the bodies over here. And there's the posterior longitudinal ligament. So where is that posterior longitudinal ligament in relationship to the spinal cord? Can you see it? Where would the spinal cord be in relationship to the posterior longitudinal ligament? Okay, that's right. Anatomy word. Anterior or posterior? Posterior. Yeah. So the spinal cord sits on top of, right? That's what you said. It's behind. It's on the dorsal side. It's on the posterior side of the posterior longitudinal ligament. When you bend your back over, does flexion or extension stretch the posterior longitudinal ligament? Does flexion of the neck and back or extension or hyperextension of the neck and back stretch the posterior longitudinal ligament? Flexion. Does everybody see that? So flexion of the neck and back would stretch this ligament. Okay? Now, let me show you one more picture, and then we'll go back. So this is an anterior view. So I flip the thing around now. Can you see the posterior longitudinal ligament here? So this is an anterior view. So what has been removed from this picture in this area? Can you see it? What would that colored blue piece be right there? No.
The body.
Okay. This would be the body, body, body. And then these blue pieces in between here, those are your fibrocartilage discs between them. Okay, so what I've done now is I have turned the thing around so you can get a different view of this. So there's a posterior longitudinal ligament that runs the extent, and it is on the posterior side of the bodies and the discs. You see that? It's on the anterior side of the spinal cord. So on your spinal cord, running down on either side of the bodies is a longitudinal ligament that goes all the way down the cord. The anterior one is on this side, and the posterior one is on that side of the bodies, of the bones. So what would you have to do to stretch the anterior longitudinal ligament? What motion would stretch the anterior longitudinal ligament? The anterior longitudinal ligament runs across the fronts of the bodies. So, what would you do? Yeah, hyperextension would stretch the anterior longitudinal ligament. Right. So those are major ligaments holding these things together. All right. Now the posterior longitudinal ligament here, where we are in the cervical spinal cord, this posterior longitudinal ligament works its way up to where the dens is, and then it becomes what is called the tectorial membrane. Now, follow the dissection here because this is a cool little place. Do you see the tectorial membrane labeled here? It is attached to the occipital bone, right near the border of the foramen magnum, this tectorial membrane. And so, what I've done here, as I'm getting deep, is I have cut the posterior longitudinal ligament as it's running across where the dens is to the occipital bone, and I've removed it. So it's been cut here, and it's been cut here. So that posterior longitudinal ligament that extends all the way down from the occipital bone, I have taken it off here, and I'm looking at structures that are anterior to it. So these structures are the ones right on what would be the bodies. Now, what would be right on the bodies of the rest of the bones? The posterior longitudinal ligament. Okay, so it's been taken off here, and you can see there's a very famous ligament here over the dens called the cruciate ligament. So it forms, this cruciate ligament forms, can you see it? A cross. Now this part of the cross has been taken off. That's the word crossing, means cruciate in anatomy means they're crossing. And so there's a cross here where there's a band that extends from the dens upward to the occipital bone, a band that extends from the dens down to the body, and a band, this is the one I mentioned in class, that extends right across the posterior aspect. There's a thick band that covers the dens like that, holding it in the fovea dentis. It's called a cruciate ligament. And the big daddy of the cruciate ligament is this one, the transverse ligament of the atlas. That's what I mentioned last time. Now, does that help? I mentioned it last time to you, but I think it's good. I should in years past been putting these things in here so that students can see them. Now that's not the only thing that holds the dens in place, because there are also alar ligaments. These alar ligaments extend across here, as you can see, from the lateral margins, from the sides of the dens to the lateral margins of the foramen magnum. So does the body think that the dens should stay in place? Yeah. So the cruciate ligament and the alar ligaments here hold that thing very nicely in place. It is the piece of bone in my vertebral column that allows me to do this. And I don't worry about that thing coming out of place. You've got to do some serious action to get it out. But as I said in class, at the end of class last time, you can do some serious action and get it out. And that is fatal many times. Oftentimes that is fatal. And you know why, right? Because the fibers in the brainstem on the anterior side are headed to C3 to C5, to the phrenic nerve. So that's what we talked about last time with those bones. All right, good, that's enough of that. All right, so thoracic bones they have some unique features about them as well. the first thing that jumps out at you when you look at one is the thoracic bones have spinous processes that angle inferiorly. So that is a major observation. Now, let me show you what happens, because this is, I mentioned it with the trapezius already. I'm going to say it again. Let me show you what happens here. When I taught you the attachments of the trapezius during the class period last time, I made an issue of this. I said, look, y'all, the trapezius attaches from C7 to T12 on the spinous processes. How is it possible for it to attach to the occipital bone and not attach to the spinous processes of the first 6 bones? How's that possible? And I told you the reason for that is the nuchal ligament, or the ligamentum nuchae. So again, this picture that I throw here today I think can be helpful in this. We're going to say this again today with the traps as we do the dissection. The nuchal ligament you can see here extends, a thick ligamentous band that extends across the spinous processes of the first 6 bones. The nuchal ligament. That's what the traps are fused to, and I showed you a picture of it in class last time from the posterior view. Now, the only other thing to mention here is this very famous ligament that runs across the tops of the spines, called the supraspinous ligament. So, let me ask you this question. What 2 ligaments have you heard me mention today of the vertebral column would be stretched with excessive flexion of the head and neck and back? What 2 ligaments of the vertebral column would you expect to be stretched or conceivably damaged with overflexion? Posterior longitudinal and this one that runs across the spines and attaches to the occipital bone. So this action right here, this severe stretching action, will pull on that supraspinous ligament. It's fused into the nuchal ligament, but it'll pull and stretch on that thing and can cause damage to it. Right, so these are clinical things. What's being damaged in your back with overflexion, overextension? Those are the major ones. All right, I hope that's helpful. I did it on purpose today to try to help, because I say these things out loud and I want you to have an image. So those are images that are not in your book. I stole them from elsewhere. So you have them now. All right, so once again, first thing that jumps out, the thoracic spinous processes angle inferiorly. The supraspinous ligament is attached to them, no doubt. There's no nuchal ligament here. The other thing you notice is that these guys have facets all over them. The thoracic bones have facets on the bodies, on the transverse processes, and they have both superior and inferior articulating facets. Faces. They have facets. They have faces. So the facets here that are superior and inferior, superior articulating process or facet, and inferior articulating process or facet, these things articulate with each other in the throughout the vertebral column. Now, the major difference here that I want to point out to you for these facets is the angle of articulation. This guy right here articulates with the bone above it. We saw the same thing in the cervical bones. They have superior and inferior facets as well. And they tend to articulate the same way, superior and inferior. And so all the way down the vertebral column, we call them superior and inferior articular processes, the facets of these processes. All the way down, they have the same names. However, when you get to the lumbar bones, the superior articulating processes or facets take on a different angle. Can you see it? So the facets of the cervical and thoracic bones, these all famous zygapophyseal articulations, those facets articulate in a true superior-inferior fashion. And they conceivably form a joint that does allow for some lateral movement. Not much, but a little bit. They are certainly potentially flexible there. There's this kind of flexibility in those joints. There's medial and lateral movement possible here. You are much more flexible in your cervical and thoracic regions than you are in your lumbar region. And the primary reason for that is the articulation of the facets in the lumbar area. Can you see what's happened to them? How do the superior and inferior articulating facets join one another in the lumbar region of your back as opposed to the thoracic region? How is that different? So all the way down cervical, thoracic, they're like this. All the way down, superior and inferior. So this flat surface, superior and inferior articulated. When you get to the lumbar bone, the facets turn this way. They turn medial lateral. So in these lumbar bones here, you can see the articulation is not going to allow that kind of movement. What does that tell you about the lumbar area? You don't want it moving around, right? And if you look at the sizes of the bodies in the lumbar area, what does that tell you? A lot of weight. Yeah. So the lumbar structure tells you what these bones are doing. The joints here in the lumbar area are not for movement. These joints are for stability. And the sizes of the bodies tell you the same thing. They're large bodies, and so that tells you these bones are weight-bearing bones in the lumbar area. They're not for mobility. Mobility is in the cervical and thoracic areas. All right, now, what are the facets on the bodies and the transverse processes for? On the thoracic bones. What is that?
The ribs.
The ribs, yeah. So the heads of the ribs articulate with the bodies. Now, this one is a little bit misleading. This one I like better. Can you see how the fovea for the head or the rib, the fovea or the face for the head of the rib is shown here? What does this tell you right here? Where do the heads of the ribs meet the thoracic bodies? Huh? Yeah, they don't hit center of the body. They actually hit at the junctions of the bones. So a head of a rib is going to articulate with more than one thoracic bone. You don't get T1 to T1, you get T1 to T1 and T2. So the heads of the bodies articulate at the edges, at the tops and bottoms. This one doesn't show it as well. What about these guys here? What articulates here on the transverse process? This would be the fovea for the tubercle of the rib here. All right. So no transverse foramina, angled spinous processes, facets that tell us about articulations for the bones above them and below them, and articulations for the ribs, the heads and the tubercles of the ribs. All right, the sacrum has also a superior articulating process with a facet there that articulates with the inferior facet of L5. So L5 sits right there on S1. S1 has a special name. There's a couple of bones here that have special names. We call C7 the vertebra prominens. You learned that in the lab. It's a prominent anatomical landmark. You can bend your head over and feel the spinous processes of C6 and C7. The sacral promontory is S1, and S1 is considered to be the body's true center. It is where all the weight of the upper torso sits on the sacral promontory, and so that's why it has its own name. Now, you can see that the sacrum has a canal in it, but you know some spinal cord anatomy, don't you? What is in the sacral canal? Is the spinal cord in there? No. Where did the spinal cord end? Where? No. So if I want to do a spinal tap, I want a sample of cerebrospinal fluid. The patient is on the table. And I want to make sure I stick the needle in there where there is no spinal cord. So I take my hands and I put my hands on the iliac crest, like this. And where my thumbs meet in the back is really close to the spinous process of L2. So it's somewhere there, L2, L3, L4. What we know is the spinal cord ends at L2. So you just want to be sure that you insert the needle somewhere below where your thumbs are meeting. Find the next spinous process and go in under it. Then go in inferior to it. Then you will make sure that you don't hit the spinal cord. Okay, so then what is in the vertebral foramen? What's in that hole if there's no spinal cord there? It's the same question I'm asking here. What is in the sacral canal of the sacrum? What's in there? If there's no spinal cord, what is it? Multiple nerve. What are they? Right. So we did this in the last presentation. I showed you a picture from the posterior view where you could see how the roots, the dorsal and the ventral roots, as they come off in the cervical regions, they come off lateral, right? C1 comes off. Help me, y'all. This is fundamental. C1 dorsal and ventral roots come off the spinal cord between C1 and the occipital bone. They form the nerve and it passes through the intervertebral foramen. As it goes through that hole, it splits up into a dorsal ramus and a ventral ramus, right? And then those fibers in C1, C2 through C5 form plexuses. Remember, C1 to C3 forms the cervica, the ansa cervicalis. And then we have C3 joining with C4 and C5 to form the phrenic nerve. Okay, so we did that before. C2 comes off lateral between C1 and C2. The C3 spinal nerve comes off between C2 and C3. Are y'all following me? Okay, so C1 is on top of C1, comes off lateral. C2 is on top of C2, comes off lateral. C3 is on top of C3, comes off lateral. Now, when we get to C7, where would the seventh cervical nerve be? On top or on bottom of the bone, of the body of the bone? Well, if we're tracking this, they've all been on top. We started at the top, so they're all on top. For some bizarre reason that I don't understand, in anatomy, the nerve on the bottom of C7 that comes off lateral is not called T1. Isn't that what you would have called it? So they each come off lateral, lateral through the intervertebral, lateral. On top of C7's body, through the intervertebral foramen, we get spinal nerve C7. The next one is the body of C7 and the body of T1. I want to call this T1 and continue down. But that's not how you number them. So once again, it comes off lateral, but now I don't call it T1. This one is called C8. Why in the world they did that, I do not know. I don't understand these things in anatomy. Why you want to make it so complicated? The numbering scheme changes. And from this point down, the numbers all go for the bones. So the number of the nerve is the numbered for the bone above it, not below it. So T1 then, so C8 is on the superior side of T1. And then the first thoracic spinal nerve is actually below the first thoracic body. And that you work your way through the thoracic region. Once again, they're coming off lateral. Now, once you start into the lumbar areas, the roots, the rootlets that come off, are going to begin to turn. And when you get to L2, you will see all of the roots that we consider the lumbar and the sacral nerves. All of those roots have turned downward to form strands. Those are the roots coming off the spinal cord, the dorsal and the ventral roots coming off the spinal cord. And they are in that canal. That is what you find in here. We call them sacral. We call them the roots of the sacral nerves. But they actually originate from the cord and work their way down that canal. If you dissect out the spinal cord, those long roots that are inside the vertebral foramen were imagined as the horse's tail. And I showed you this last time. We called it the cauda equina. The horse's tail. Cauda tail, equina horse. The horse's tail. And that thing extends down through the sacral foramina and then gives rise to the sacral nerves as they pass through the sacral foramina of the sacrum. Okay, so that helps you for context for what's here in the sacrum. We also know that the sacral tuberosity is an articulation point. This auricular surface of the sacral tuberosity is sometimes labeled the sacroiliac joint. That's where the sacrum articulates with the ilium of the hip. And you can see they have lateral crests here. Lateral and median crest here. The median crests are what we would have called the spinous processes of these bones. All right. What else do I want to say there? The coccyx is the last fused 4 or 5 bones, normally the coccyx, that are fused together here at the end of the vertebral column. The sacrum in the adult body is 1 bone, and the coccyx is 1 bone. So, don't be confused with the numbers, right? There are 12 pairs of cranial nerves. There are 31 pairs of spinal nerves. There are 26 vertebral bones. How is it possible that there are 26 bones and 31 pairs of nerves? Simple.